Hello friends, welcome. Today we'll be reading about ischemic heart disease. I know, it's a very interesting topic. So, let's get started. First thing first, let's dwell into the physical findings. If a patient walks into your ER, the casualty room, what are the physical findings you can look for in the patient? Of course, you'll get an EKG, but these findings, you should know about them and you should be able to recognize them when you see them. Now, again, these could be abnormal, but not always. Rather, in the majority of the patients, you might not see these findings, but when present, especially in combination, they can really help you a lot in forming your diagnosis of an ischemic event. First system is your heart, or the cardiovascular system. It can have four findings: the S3 gallop, the S4 gallop, JVD, or MR. S3 gallop. This is due to a dilated ventricle. This is the splashy sound, which is due to, yes, you're right, the dilated ventricle. Next sound is the S4 gallop. It is because of a hypertrophied left ventricle, and since the atria has to give a push to the blood, also known as atrial kick, S4 gallop is produced. Then third is the JVD, the jugular venous distension. Since the blood is not flowing forward, because there's an ischemic event and there's stasis of blood, the heart, the pump is not functioning as efficiently as it should. You have kind of backflow, more of a stasis, and hence the JVD. And on similar principles, you'll have a MR, mitral regurg, which is a holosystolic murmur. That concludes the CVS exam. Now, coming on to the chest for respiratory system. Now, you all got your stats with you. Yes, you do. So, get on with it. Check out the chest for CHF, congestive heart failure findings. Yes, the RALs. You'll be able to listen to them. Not all, again, but a few patients. But when you listen to that, you know it's because of congestive heart failure. The third, we deal with the extremities. There can be edema in those extremities. And lastly, the general exam. How would a patient with an ischemic event appear to you? Yes, that would be the typical picture of a MI patient. Shortness of breath, the patient clutching his chest in acute distress. Alright guys, so that concludes the examination of the four systems. First is your heart, the CVS. Second is the respiratory system, then the extremities, and lastly, the general exam. Alright guys, it was great to meet you again. See ya next time. Bye bye for now.